Is it recording? Oh. Hello, welcome everyone to Workshop 1 video. We're really excited to have you guys. This has been such a great journey for us, and we're just really honored to have such amazing participants joining us for this training. And what we want to do for the first training is really train you on how to train your learners look at human trafficking from the lens of public health. And I'm just going to share my screen here. So as we're going to do for all of the workshop videos, we want to welcome you to open your digital workbook. And as you're watching the video, we want you to really engage with the material through some probing questions that we've placed in the digital workbook. So for this workshop, we want you to consider what are the things that you feel are not obvious to health professionals about human trafficking? How would you teach the public health approach to trafficking? And what's one thing that surprised you about this video? That's great. So as Hani mentioned, in our introduction, this is really a summation of all the activities. It's your pre-work, it's this training, it's the generating of knowledge amongst each other. Because there's so much, we can teach you so much, and there's so much to be trained on human trafficking. So what we want to do for this workshop is really highlight for you some main important points that we would want you to relate to your learners. So we want you to be able to teach how to define human trafficking and understand terminologies, describe types of human trafficking, and really describe the public health approach to human trafficking, as well as the SOAR framework. You all are amazing trainers, and we're all aware that every human trafficking story has its own unique and traumatizing experience. But within that experience, there are some shared experiences, and the shared experiences that all of them have been exploited for the profit of somebody else. And I think the more we are able to train others to recognize the shared experience, the better our community of health professionals can be in identifying and tackling human trafficking when it comes into their work settings. So Rahel, one of the learning objectives is that they should be able to teach the definition of human trafficking to their learners. And I mean, these are a group of experts on training others. We have Adine and Patrick and Jenny and many others. So what do you think that health professionals really are not aware of when it comes to the definition of trafficking? Like, what is not obvious to a health professional, from the get-go? Should they emphasize some points? Honey, I love that you asked me that question. In fact, I was waiting for somebody to ask me, but then I realized I'm speaking to a computer. So I'm so glad that you're here. I think that's a really great question. You all are aware and understand the definition of human trafficking, but what I think is really important to highlight as you train this concept is that not everybody knows that children under the age of 18 years old who are induced into commercial sex work are considered trafficking regardless of means. And so that's really an important point to highlight. Really, another thing to highlight is that as health professionals, it is good to know the definition of human trafficking, but it's really not the role of health professionals to make a legal determination on what constitutes human trafficking. So they should really just use that as a framework in helping them recognize or identify signs of trafficking. But it's not really their role to ensure that this is really, they're not a, exactly, it's not their role. Judge, yeah. And the other thing that I think oftentimes can be not as obvious or intuitive is really there are many different forms of means, and oftentimes people don't think about the psychological coercion that can happen where victims are really, it's kind of like those invisible chains where people ask, why don't they just leave? And they don't see that invisible chain that entraps them and that coercion that takes place psychologically. And I think the other thing, I remember I had a patient who was forced into labor trafficking, and she was so afraid to leave or take legal action because she came from Latin America and they were threatening her family in Latin America. And so she was afraid that if she took some kind of legal action here in the US, that some repercussion can happen overseas. So those are things that I think health professionals may not be aware of and obvious to them that we really need to highlight as we train this topic. Yeah, I totally agree. That makes sense. That's great.
A couple of other things that I think are important to highlight is, traditionally, I think people think of human trafficking as something that happens to women and girls. But the reality is that human trafficking affects both women, men, children, and boys, right? It affects all genders. And so that's, I think, important for us as we train others to highlight. The other thing that's really important to highlight is that trafficking doesn't really require crossing of an international border, that it can happen right here in your own small town or big town that you live in. And, I think the other very important point is that you can never consent to human trafficking. People may say that they willingly stayed, they just never left, so they must have chosen to. But the reality is that when you can never consent to human trafficking. It's something that you're forced into and coerced into. And another important point is trafficking is really not the same thing as migrant smuggling. Oftentimes even in the media, they're used interchangeably, but they're really not interchangeable in one sense, right? Because when we think about human smuggling, it involves one person illegally crossing an international border. And we've established that human trafficking can happen without ever crossing a border. And the other is that human smuggling is voluntary. Like, people want to cross over, so they pay money to a smuggler to bring them over to the country. But once they're there, they're kind of free of their smuggler. Whereas in human trafficking, it's never voluntary, and they're really never free right there.
So could there be a situation, I think that distinction is really important. Could there be a situation where a trafficked person is like smuggled at some point?
I mean, I think that's a really excellent point. The thing that you have to recognize, and I think what we have to highlight as we train this, is that there's this really Venn diagram where smuggling can be very much part of the trafficking story. In fact, the patient that I just referred to earlier, she was initially smuggled into the country by people that she knew in order for her to come to the US. But then once she arrived here, she was induced into labor trafficking. And so it can be very much part of the trafficking story, and they're not mutually exclusive at all.
Got it. Yeah, I think that's something that health professionals really should be aware of.
Yeah, and I think that's really great. I mean, like,
yeah.
What is up with the sex bubble?
Well, I'm so glad you asked, Rel. So I created this slide a while back now, because this is what I see when I look at the anti-trafficking response in the United States, where attention, where funding, where policy is really focused. And the reason we have it on this training for trainers who are training health professionals is that health professionals are in society, they're consuming media that's telling them that trafficking, if they've heard of trafficking at all, like that trafficking is sex trafficking, that trafficking happens to white cisgender females and children who are abducted or whatever. And so, like, we're going to be talking later about bias and actually throughout about bias, but when we're training health professionals, we have to realize that that's kind of what they're coming to the table with. They're not a blank slate. And so we need to make sure that we're highlighting the things that are less obvious to them and that maybe they've never even heard about. That's really good. So on that note, we know that internationally, labor trafficking is at least 3 times as common as sex trafficking. And yet, when we look at the landscape here in the United States, you rarely hear about labor trafficking. And so just even putting out labor trafficking front and center is really, really critical for health professionals, because they'll otherwise not see it if they don't see what they don't know. And then even among labor trafficking, they may think about, field workers, folks that are doing agriculture work, working in factory or in construction, but maybe they don't realize that people have been actually trafficked in healthcare settings, or that they're trafficked in private homes, like, doing nannying or cleaning. So those are some of the less obvious things to emphasize with your health professional learners.
I think that's a really good point. And similarly, just with that bubble that you just pointed out, that a lot of health professionals may think about sex trafficking as occurring in like massage parlors or brothels or, live sex shows, but not everyone really thinks that it happens in expensive hotels, that it's just not in cheap motels, or that it does happen in private homes or online. So it's really important to point out as we train the non-intuitive places where trafficking can take place. And I think similarly too, when we think about who are the traffickers, oftentimes, people think they're strangers, or people that they don't know. But the reality is that most often the traffickers are known by the victims. They can be family members, they can be romantic partners. And that's really very important, especially when it comes to assessing a potential victim of trafficking and who they're coming with, which we'll talk about later on during this workshop. The other thing to me that's, human trafficking has been called like the invisible crime, or a crime or that's happening within the shadows or before our eyes. And that's because people tend to think that that happens out there. It's not in my city, it's not in my state, or it's in other countries or other places. But the truth is that human trafficking happens everywhere. And, I just had we had a psychology intern that we had presented a similar presentation to, and a month later she went to her nail salon and began to recognize that the person that was doing her nails was a potential trafficking victim right there in her own community and city. So it's really everywhere, and that's something important to highlight to our trainers.
Yeah, and I'm asked, like, sometimes when I do a presentation, can you give us like all of the global statistics on trafficking? And sometimes I will include those, but I think more important and more motivating for an adult learner, for a health professional adult learner, is actually knowing what kind of trafficking is happening in their own communities to really bring it local. And so a couple of techniques that you can use that I use, one is the Polaris heat map that we show here is representative of calls to the hotline with tips for potential trafficking cases, and in many ways is honestly more a reflection of awareness than anything else. But if you had, for example, if you were teaching a health professional audience in the Northeast or in California or Florida, you can see that you'd be able to kind of demonstrate the number of calls at the very least. Another technique that I use is also, before I train in a community, I'll Google local news about trafficking. I really try to zoom in on labor trafficking, again, because it tends to be the more hidden form of the crime. And in this case, in the bottom right here, we have a case from San Antonio, Texas, of a labor trafficking victim. He's originally from Mexico, and he was trafficked to work in agriculture and was shuttled in different, depending on the month of the year and the harvest that was going on, he was shuttled to different places in the country. And so, when I'm training in San Antonio, that's an article that I'll use because it really brings it home locally.
Yeah. I love that. That's really great. I've always thought of human trafficking as a crime. And so, I wonder, if I was David, I would probably wonder, what does public health have to do with human trafficking?
Yeah.
Can you kind of shed light on that?
Well, I'm sure David already knows the answer to this because he's done the SOAR online training and is also a trainer. But in all seriousness, trafficking is a crime. Of course, it's a crime, and it's a public health issue. And if the only players that are at the table that are thinking about trafficking are those that are in the criminal justice field, they're only bringing that perspective and lens, and we're going to neglect things that are so critical that are part of the public health approach, like prevention. So what is public health? This is a term that you hear, but what does it actually mean? So this is the definition from the Centers for Disease Control. Public health is the science of protecting and improving the health of people in their communities. This work is achieved by promoting healthy lifestyles, researching disease and injury prevention, and detecting, preventing, and responding to infectious diseases. So just highlighting some keywords there: communities, and you also see prevention. A lot of this definition you can see is referring also to things like HIV in the public health approach there when they talk about infectious disease. But I digress. So you mentioned that this, trafficking is a crime, and we know that the criminal justice system needs to respond to trafficking, and that we need to have a public health framework. And it's not surprising that those responses are going to look different because the goals of those systems, the way they're structured, are fundamentally different. So criminal justice is really thinking about how do we uphold the laws of the state. Whereas for public health, we're thinking about how do we advance the health of populations. And so everything then follows from there in terms of the lens that we see and approach trafficking from. And so Another distinction that I wanted to make here, because these terms are often conflated and confused, is like, what is the difference between public health and the medical model?
Yeah.
And when we're talking about the medical model, we're talking about individual. That's the main distinction, and then public health is more on the population level. Of course, we know that many healthcare systems and many good healthcare systems are thinking more on that community level, but that is a distinction in terms of the terminology.
That's good.
So the other piece that I want to highlight, and this was kind of in the definition, is that public health is very methodical and stepwise in terms of thinking about how to approach a problem. And this has been a tried and true technique throughout other forms of violence, including child abuse and intimate partner violence. But first, public health will identify the problem, identify risk and protective factors, prevention strategies and implementation. And the field, when it comes to trafficking, a lot of these areas don't have a lot of evidence yet, because it's something that's ever evolving, and researchers are just really getting started on studying effective approaches to trafficking.
Oh, that's cool. Honey, there's something I've been just really confused about.
Yeah.
So we have this like 2-day training, and then we made these amazing people do all this pre-work. Why did we do that again?
Well, because we like them so much, and well, the reality is that we wanted to make sure everyone was coming into this training, these 2 days, on the same page, and we all come with our expertise and our own lived experience and our own training and education, and we wanted to make sure that everyone was kind of coming in from the same place.
Yeah, and so I think that's really great. So we want to level the fields a little bit.
Yeah, exactly. So along those lines, one of the things that we want you to think about, we're not tied to the SOAR framework, but we do think it's a really organized way of training health professionals on trafficking. And so when you're designing your training, you don't need to start from scratch, but this is one framework that you can use. Another tool that we wanted to share with you is the HEAL and Laboratory to Combat Human Trafficking's curriculum assessment tool. So as you're designing a training or maybe evaluating somebody else's training, you can see whether that training checks all the boxes for a human trafficking 101 for health professionals. And it's kind of like a self-report card that you can do. So it goes through things from design all the way through like content areas. So also, it was just featured in the U.S. State Department's Trafficking in Persons 20th annual report. So we were really excited that it was highlighted there, because it's been downloaded already in 35 countries. So it's getting a lot of it's having a lot of impact around the globe.
So I think then, like, as we finish up, what is really important that we want you to have in mind as you develop a training, as you train others, is really some foundational principles in approaching human trafficking in the healthcare setting. And one is that, it's inclusive of all types of trafficking. It's not just one or the other, but we want to include all trafficking. And then the second is that it has to be through the lens of trauma, and it has to be survivor informed. And thirdly, you have to have a culturally and linguistically appropriate training, because that's really one of the bedrocks of having a holistic care. And then lastly, it has to be multidisciplinary, that you can't really be a lone ranger in this. You have to work as a team and build collaboration to really fight the crimes of human trafficking. So as we finish off for this last workshop, what we want you guys to think about, and we're really looking forward to seeing you on Zoom. It's like the second best thing to being in person, is think about what was it that surprised you from this video, and what is it that you want to learn more about. And we really look forward to seeing you.
See you soon
in a few minutes. Bye.